This conference will now be recorded.
All right, thank you for being here with us today, childcare providers and our special guests. This is another peer-to-peer networking meeting. Today, we will be talking about the updated childcare guidance for your program. And we have special guest Heidi Hotvedt again. And we also have some childcare nurse consultants on from the Region 4 area. So we're excited to have them with us today. I'm just going to go through a couple of housekeeping things, and then we'll continue with introductions and the meeting. So if you have attended one of our peer-to-peer networking meetings before, you've definitely seen this slide. Just a few housekeeping things I wanted to talk about before we get started. There are featured buttons on the bottom left-hand side of your screen that will allow you to mute or unmute yourself. We do ask that you remain muted to minimize any background noise while the speaker is presenting. If you have anything to share, we really encourage you to use that chat box or even unmute yourself if you feel comfortable. And also, just for the real purpose of these peer-to-peer meetings is also to connect childcare providers with one another. So feel free to use the chat box to share anything that's been going on in your program, any ideas you have about any of the topics provided. We really want to give you that opportunity to connect with other programs. So you will find the chat box and the settings wheel in the upper right-hand corner in case you need to use those. And we will monitor the chat box, and I'm hoping that we have time to answer everyone's questions after reviewing the guidance. So welcome, Heidi Hotvedt and childcare nurse consultants. I thought this would be a good time for the childcare nurse consultants that are on to go ahead and unmute themselves and introduce themselves, maybe share your name and the area that you serve, and then we'll have Heidi do her introduction and she can start her screen sharing when she's ready.
I'm Melissa Garten, and I serve Polk and Dallas.
Good, great, thank you, Melissa.
Hi, I'm Lynn Wente, Madison and Warren counties.
Thank you, Lynn.
I'm Karen Ritter from Good Shepherd in Eldora.
All right, awesome. We probably have a few still coming on. There is a great map on the Healthy Childcare Iowa website where you can find your childcare nurse consultant that serves your area. So be sure to check that out. I had taken my screen off so that Heidi could share hers, but I put it back up so that you could access these websites really quick. As she's introducing herself, I'll go ahead and switch that presenter mode and she can share when she's ready.
Great, thanks so much. So my name is Heidi Hotvedt, and I'm the coordinator for Healthy Childcare Iowa. My contact information is there, and I am proud to represent all of our childcare nurse consultants across the state. We cover 99 counties, and there's 34 nurse consultants statewide. I know a few of them are on today, and just want to go over some of the updated guidance, and then some of the frequently asked questions that we seem to be getting. I'm going to be sharing some of that information too. So if I can share my screen, I'll start my PowerPoint.
All right, great. Sounds good.
Thank you.
Mm-hmm.
Okay, 1 second here. Hopefully you're all seeing my screen. So I'm just going to jump right into kind of our updated childcare guidance. I decided to put that first because that seems like that has been a lot of questions. That was updated last week, August 13th. And I know there is quite a bit of information that has either changed, some guidance that has changed or been updated. And I guess I'm just going to start by saying thank you for your flexibility, because we know that we are having a lot of changes. and it seems like it's constant. And I'll just share a little bit, even for myself, even though working with Iowa Department of Public Health in the Healthy Childcare Iowa section, you know, there's a lot of collaboration that's going on, which is great, between Department of Human Services, Iowa Department of Public Health, and then also now Department of Education, because of with schools coming back on. So this has been, you know, it's a work in progress, and it's not just a work in progress because of collaboration. It's really because we're learning more about the pandemic. We're learning more about COVID-19. And so I'm actually in a cohort of other state coordinators in the United States, and we meet usually every other week or sometimes weekly as things change. So when new guidance comes out from CDC, and it's really a chance for me to really see that this is a challenge for a lot of states to really stay up to date with all of the information and to be consistent across our state entities. So just like I said, thank you for your flexibility, and know that what I'm presenting today is interim guidance because it could change next week. I actually presented last week to a group of home providers in another CCR&R region and had a follow-up email. And from the time I presented to the follow-up email, the guidance had changed. So I could provide her with the most up-to-date information as of this updated guidance. So just wanted to kind of start with that. But I just wanted to share a few things in that childcare guidance, and you all have access to that. That's on the Department of Human Services website, and also is linked from our Healthy Childcare Iowa website. So we try to, and CCR&R actually links too. So we all three try to link to each other so that that can help share the information. So if you're looking and you're at one site, just you'll be able to find it one way or the other, or you can always reach out to your nurse consultant locally if you're having any questions. But a couple things that I wanted to just highlight from this updated childcare guidance document was about face coverings. So that has been, a question, I think, pretty much, I would say, since one of my first emails that I had sent out saying that at the time, and this was months ago, that the Centers for Disease Control was not recommending face coverings in the childcare world. And then that changed quickly as data really was showing that face coverings do work, whether that be cloth face coverings or PPE type coverings that would be more in the medical world. And so this guidance now that has just been updated on August 13th is saying that really they're encouraging face coverings for staff and school-age children. And we know that younger children under the age of 2 are not able to wear face coverings, but older children are. And so they're really having that encouragement for staff and school-age, mainly because I would say across the state of Iowa, I would say most school districts are mandating school-age children to wear masks in when they're attending classes. And so, and as of the state coming out with encouraging masks being worn or face coverings being worn, and I'm using that term kind of interchangeably. Okay, so I think everybody understands that we're talking about the cloth face covering, or as surgical masks are becoming more available. I know people wear surgical masks sometimes out in public. So those are really being encouraged for staff, and we've been encouraging that for staff for a while, but the school age is kind of new. And I would say really consider it for all children. I mean, if you're going to put this in effect for your school age and they're wearing them in the school system, I would just say for your own program, you may consider saying, okay, we're going to go ahead and try to do face coverings for all of our children that are over the age of 2. And we do know there's a lot of things with face coverings in terms of decisions to be made. You know, who supplies them? Is that going to be your program's going to supply them? Are parents going to be asked to supply them? We do need smaller sizes for younger children, as you can imagine. They don't fit as well, the larger size face coverings. So really thinking about that. Where are you going to store them? And this has been a question I think I've had multiple times. And really, the Centers for Disease Control does not have specific guidance around storage, except that they need to be stored in a clean and disinfected area. And I've had a lot of questions in terms of that. But I would say my recommendation has been, consider, I think we're going to be using cloth face coverings for a while. So rather than thinking about plastic bags or paper bags and having to throw those away, get a little small plastic container that you can easily buy at any store, grocery store or in a big box store, and consider having a plastic covering, a covered container that you can store the cloth face coverings in, and then those can be disinfected. Those are easily then disinfected by using your disinfectant spray or running them through the dishwasher. And so that would be highly recommended, rather than kind of having these temporary storage things where you're going to use, a bag or something like that. And I know I have had some questions is, could they be hung on hooks? And really, I would say that, they could, if that would be the only opportunity, but the challenge becomes, is that labeled for the child? Is there a chance that that could be touching other people's, things that are hanging, backpacks, such, we know how that is with the hooks. With even hanging coats and the concern, we always say with head lice. So, I mean, you kind of think about, how is that going to work for having masks hanging there? And would that be the best sanitary place to have them? Because this is something that the child and staff are going to be wearing on their face. So we want to make sure that it's clean and sanitized. So, and then the other thing too is for face coverings is really to look at that guidance document on. And Iowa Department of Public Health has some great information on, how do you wash them? What do you do for storage? What sizes? They have patterns on the website. So that's a really good resource for face coverings if you're looking at that. The next thing, and one other thing too, as storage is a big issue in childcare, because as we know, kids can't be, they don't wear their face coverings when they're eating, and they eat pretty much 4 times a day if they're there for the day full program, breakfast and lunch and maybe 2 snacks. So it's a lot of taking that off and putting it back on. And if they get wet or soiled, of course, they need to be replaced. So, like I said, storage is probably the #1 thing to be really considering. Physical distancing. This is one thing that has been, updated. Department of Human Services is no longer recommending limiting rooms to 10 individuals or less. That was some recommendations that had come out. And what they're recommending right now is physical distancing in those older age groups where you can do physical distancing, or at least keeping your group static and keeping your clusters together so that you're not doing floating staff or joining staff and children in larger group settings and then not able to maintain physical distancing of 6 feet. So that's a change in the recommendation, but like I said, keeping group static is still there. I would say we are tracking outbreaks in childcare, and floating staff is probably one of the things that we need to really avoid doing, because that seems to be really problematic when it comes to a staff person or a child, testing positive for COVID, and then looking at who their close contacts were. And when you have floating staff who have floated from room to room to room, that really puts that challenge then of a lot of kids and staff that are needing to be quarantined during that period. So that 14-day period. So that keeping those groups static and trying to avoid that floating staff would be great to help your program mitigate the risk. The other thing that has really, this is a big change, the recommendation continues to be that we continue to health monitor and screen children on admission, but that was a requirement for DHS, and that is no longer a requirement. It's more of if feasible to continue to do it. I will tell you that I think with Iowa and having health monitoring as part of our regulation and requirement, that has been very effective for our states to try for our state to be able to keep programs open and to limit potential exposure. So it is really a great practice, and it is best practice, and there are guidance. There is guidance on that on the CDC website. But if it's not feasible for your program, or you're having real challenges with it, The other option would be to have, and this is what DHS has put in the guidance document, is to have parents do a self-check. So the parents could be checking their child and reporting to you those symptoms, you know, and what their temperature monitoring was at home. So that's another option, and so that's in the guidance document as well. I would say the other thing, and this is actually not really new guidance, but I do want to I want to highlight this, is that they're really Iowa Department of Public Health and Department of Human Services are saying if children and staff are symptomatic with COVID-19, they should get tested. And that's a little bit of a change. You know, we always have been recommending that as childcare staff and children have been put as a priority group for testing. But this is more of a should, and we really want to make sure that we are, if there's symptoms going on for a child or staff, they should get tested, and they can go to the Test Iowa site. Now, the one thing a little caveat I do want to say is that children for Test Iowa, they need to be over the age of 1. So if they're infants, you know, I would have them then reach out to their primary healthcare provider. And of course, staff and children of all ages can reach out to their primary healthcare provider for questions about testing. But we do know that the Test Iowa site is prioritizing as a priority population children in care and school kids, and also staff. So just so you're aware of that. I see a couple chats. I don't know if there's anything in the questions just right off the bat. Julie, do we want to cover those, or?
Yeah, absolutely. Yeah, we do have one question is, should we limit the number in the room if 6 feet distancing by square footage does not work mathematically? I know there's that you've kind of talked a little bit about that, and that it's just kind of a hard thing too, like you said, with younger children. So
yeah, I mean, it's very challenging to have, you know, that social distancing or that physical distancing, depending on your, you know, your room size and how many individuals that are in the room. And like I said, we're not, DHS is no longer recommending those smaller size groups, which is what they would recommend it in the beginning, but really looking at your space and just determining what's going to work best for your program. And, you know, because we do know smaller groups, you know, it works. It is best practice because then it's less exposure risk when there's less in the room, and then there's more physical distancing that can occur. However, we know that with young children, you know, we really can't, it's hard to social distance, and you can't with infants and toddlers because you're doing a lot of hands-on care. But for those older kids, yeah, physical distancing is an option.
yes, absolutely. Thank you. And then I know you talked a little bit about the different types of face masks, but there's a question on if there is a place that providers can find suggestions on different types of cloth masks that can be found.
I know the Iowa Department of Public Health website does have some information on the different types of cloth face coverings. I know there's some research out there too that the CDC has actually in their cloth face covering. It's right on their main page, the CDC website, that talks about, you know, what's best. There's different thicknesses of the cloth. They say that 2 or more layers is best. I know that's on there. And there's been some research that has been done about different types of cloth face coverings and what works best. So that I think that, you know, looking at those resources to kind of make that decision if you're thinking that you're going to be purchasing them for your program.
Great, thank you. And then there's a question about air purifiers and using those in the classrooms. They have a couple of classrooms that don't have any windows, and it's an older building. So have you heard anyone using those?
Yeah, and you know, right off the top, I would need to look that up again. I know that there has been some different types of products on the market that the CDC has put some information on their website about. I've seen some different types of like air sanitizers, air purifiers, and stuff like that. And I think the research is maybe not quite complete in terms of some of those products out there. So that's something that definitely, I'm just going to write myself a little note here, and I will follow up with that so I can send that out. Is that something I could send to you then? And you could
Yes,
share?
absolutely.
Okay, great. I
Thank you.
will do that. Anything else?
Yes, if physical distancing isn't feasible on the playground, do you recommend face masks or are there other options to consider?
I think the one challenge about face masks when kids are physically active is that can be a concern, but we do know that that there's kind of some information on there too about that cloth face coverings, can be worn in the outdoor environment when kids are physically active, as long as they're not having some respiratory compromise. So, physical distancing can be challenging in the outdoor area. I would say though, keeping your groups the same and not having shared space on the playground would be a best practice, so that you're keeping that group static. You're having that group of kids going out to the outdoor play area as a group, and not joining with other kids out on the play area or on the same play equipment. So you could physically distance that way, at least with your groups. And then, like I said, looking at that information on cloth face coverings in terms of being outdoors and playing.
Great, thank you. And then we have a couple questions about temperature checks. So we have one question just to know if they're required or recommended, and then if the temperature level is still 100.4 or less for a healthy child.
Yeah. The fever definition continues at 100.4, so that's the same. And at our old guidance document was a requirement, for the temperature monitoring, and that is now, if feasible, continuing that health monitoring, or have the parents check the temperature. Great question.
And then how do you recommend seating children at like a round table for mealtime?
Yeah, meals are really challenging because you do not have face coverings on when you're sitting at a round table. So I would really just encourage you to reach out to your local nurse consultant with some of those things to help you kind of figure out your policies where it's specific to your location. That trying to do those best practice guidance in terms of physical distancing. So I would probably, because I think it's really helpful. The local nurse consultant and the local CCR&R consultant, they know your program. They kind of know your space. So I think it's really helpful to have kind of somebody that has that knowledge of your location to be able to make those specific guidelines.
Great, and that's all we have for questions for now.
Okay, we'll just keep going then. Okay, so I do want to just, this has changed a little bit, the isolation guidance. So I want to just real quick go through it. So we had the isolation rule was, if you think or know if you've tested positive or have COVID symptoms, and of course we would recommend if you have COVID symptoms, going back to the previous slide, that you get tested. But if you think or know you have COVID or have symptoms, that you would have your isolation rule. And we used to say it was the 10 and 3 rule, which was 10 days since symptoms first appeared, at least that amount of time. And then it was 3 days, but now it's 24 hours fever-free without fever-reducing medication. And the symptoms have improved. So it's all three of these need to be in place before you would end isolation. So, best would be get tested, because the guidance is clear from the CDC, and current guidance is if you have symptoms of COVID and you test negative and have not been exposed or with somebody who is positive, then you can return 24 hours fever-free without fever-reducing medication. So this can really shorten the isolation guidance if a staff or child is tested and tests negative and meets that criteria. And that's also spelled out in our childcare and on the CDC website, and then also it's spelled out in the new childcare guidance documents. So I just wanted to make sure you guys were aware of that.
And we did have one question that I didn't get to, Heidi. It was about
okay.
UV light disinfecting. Have you heard about anyone using UV lights for that?
Yeah, and that's one I know I just looked up recently, so I can actually say that there is not enough science on that just at this time for using UV light for COVID. So I think they're looking at that, but they're not. They're not sure about that at this time.
All right, thanks.
Okay, I'm just going to talk about case reporting and outbreak guidance. So this was also a guidance document that, let's see, it came out the 5th of August, or what was updated, I guess the 5th of August, to really talk about when there's a confirmed positive case. And so, so we think about case reporting, and then we think about outbreak. So case reporting is that you would be reaching out to your DHS licensing consultant or registration consultant if there's a confirmed positive COVID case. So that would be one staff member, one child. So that would be that you would be reaching out and talking with them about what the next steps are. And then the outbreak reporting is if there's 3 or more confirmed positive in staff or child that are unrelated. So when you are looking at outbreaks, we're really looking at unrelated. They're not in the same household. So, or not the same, family member, so not in the same household. Then we look at that outbreak. So that reporting is really that collaboration, and it's the collaboration with DHS and with local nurse consultants, and then also with me if it's an outbreak. So really wanting to help you through the process of when there's a confirmed case, because if there's a confirmed positive case, so I'm just going to give you a scenario in a staff person, we're going to ask some questions of, okay, when was the last time that person worked? And we always look at when they were there, and then 2 days prior, so 48 hours prior, and then who did they work with, and were they within those people, either children and staff, within 6 feet for over 15 minutes of time. So that's where we look at close contacts. And so going back to that, keeping your group static, that, if you have a static group and they work with the same group every day, so we're really looking at just that classroom. And so we walk you through that, just trying to figure out where who the close contacts are. And then your responsibility then is to contact the staff and families of close contacts to explain to them that there's been an exposure to a positive, and we're just talking positive cases, not a suspected, but an actual confirmed positive COVID case, and that you're letting them know through your notification, and that's no different than we would do with any disease notification, that there was a potential exposure. And then you should be you'll be recommending and letting them know that they need to quarantine for 14 days, and that and how that's going to impact your program. Depending on the impact, you may be closing that classroom. You may have to close more classrooms than that. You might be short-staffed, so now you're going to run into problems where you might not be able to stay open. So there's a lot of decisions that need to be made, and that's really what we're here to help you with, to work through that. And then the CDC actually has a helpful quarantine scenario calendar. They actually have calendars and scenarios on their website, which has been really great and helpful, because we really need to count out those 14 days to make sure that we know when people can be back to work or when people can be back into care. So your local nurse consultants can help you work through that along with your DHS consultant. And then also, if it's been an outbreak, then you'll be letting your DHS licensing person know that now you have, you had maybe 2 confirmed cases and now you have 4. So now it's an outbreak, or you have 3 and it's an outbreak. And so you're letting your DHS person know that, and then they will actually contact me so we can track it. So we want to track those outbreaks. The challenge is we're really looking at confirmed cases. We do know that children can have very mild symptoms, they may not be showing illness. It is challenging, and we are aware of that, and we do know that sometimes even with staff. I mean, I was talking with an individual just today where you know, the symptoms were very mild, you know, headache, not feeling that great, not kind of the symptoms that we would be thinking about, but they are on the COVID symptom list, and I'll just review that real quick. You know, fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, something that's new occurring, a sore throat, congestion or runny nose, nausea, vomiting, diarrhea. And this is just the list that we have now, and that list has changed. So we do know that, you know, when we used to, in the beginning, we were really looking at fever and cough and shortness of breath as the three primary symptoms of COVID. And now we know that there's a lot of other symptoms that people are having and still testing positive for COVID. So just so you're aware of that. If you have questions about that case reporting and outbreak responsibilities, please refer to the DHS guidance document that's on the website, and that's also linked on our website too. Is there any questions about that?
Yes, there's a couple. So there's a question about like a close exposure. So if someone thinks they're exposed, can they come back after a negative test, or should they still quarantine for 14 days since they were exposed?
Yeah, so there is some updated guidance related to staff. And so you can refer to that guidance document on the childcare guidance, that updated guidance document. But in general, I'm going to say in general, quarantine is for 14 days, and that's for close contact, 6 feet of infected person for 15 minutes. And like I say, we go back 48 hours in terms of that person's symptoms. So, you know, we really want to be following that quarantine period for 14 days. And if somebody isn't having symptoms and they get tested, just because they're negative one day doesn't mean they couldn't test positive the next day. So it's only if a person has symptoms of COVID-19 and is tested and it tests negative and hasn't had an exposure, or is living with somebody or has been around somebody that has been positive, that's when they could return early. And I'm just gonna, I was gonna just
Great.
show this.
And then another question.
Contact. Oh, sorry, that close contact definition. I just wanted to put that on there so people can see that. Okay, go ahead.
Great. We just had one more question about symptoms. So how many symptoms before one should get tested? They said that they've seen some guidance, you know, 1 or 2 symptoms from this list, or if they have any at all, should they get tested?
And I would just say that, you know, because we have, you know, we have really, in our state, we have not had challenges with getting tested, and we have those testing opportunities available in our state, and that were listed as a priority population. One symptom, and that's what you'll see other states. I've seen, actually, I've seen quite a few different states, and in my cohort group, we've talked about kind of some states are clustering symptoms and saying if you have these symptoms, or if you have 2 or more of these symptoms, and they'll have different lists. And I'm not sure. We might, Iowa could change. We might go to more of a clustered symptoms. But at this time, as of today, you know, we have testing available. And even if you had just one symptom, you know, if you just were achy and have a headache and you're just thinking, I'm just not feeling my normal self, you know, go on the Test Iowa site and see about getting tested. So.
Absolutely. And then what is the recommended time frame for center closure if a positive case is reported? They've heard some conflicting numbers of days.
So we always look at, we really don't necessarily close a program. I mean, it's really going to go back to who is affected by the close contact definition, and how many staff children that will amount to. I mean, it really depends on your program because every program is a little different. So when we look at that close contact, we will actually use that quarantine, those calendars and really go through, okay, here's when the last exposure was, here's the group of kids and staff that were exposed, and then those close contacts need to be quarantined for 14 days, and how does that impact your program? So if that impacts the program where they have to close because of the number of staff that are going to be out or the number of children, or they've had so many cases that they just feel like they need to close for the next 14 days, then we look at that, we follow that guidance in terms of quarantine period and follow that. So you might sometimes, and this is, every situation is unique, and that's why we're really here to help, because you might have one positive case. So you have just a staff person, but the last time they worked was 3 or 4 days ago. So we're counting from when that exposure occurred. So then all of a sudden, you don't find out that they were positive, but they haven't been in your building. You haven't had any more exposure during that period of time. So we're still counting from the last exposure, but by the time we're counting those 14 days out, maybe it's going to be 10 days because we don't know, you didn't know they were positive. That happens sometimes on the weekends or if somebody's been on vacation. So every situation is very unique, and that's why we're here to help. I hope that explains it, because we get that question a lot.
Yep, and that's all for now.
Okay, great. So I'm going to just continue on with my slides. So I do want to just say, we do still have some guidance around our recommendations, and we do still recommend best practice guidance, referring to the CDC when there's concern. So, temperature monitoring is a best practice. And so doing health checks, whether that's going to be, it's not required anymore for your program to do that, but still putting that procedure in place, either by having parents do it, or if it's something that's been working for you, continue to do that because it is a good recommendation. Children and staff, or staff with illness. So that's one thing that we've said. If somebody has a pending COVID test, in the past we always said they should not be in care. If they shouldn't be working, or they shouldn't be in care if they're pending. And that's changed a little bit, where they're really saying children and staff with illness pending a COVID test shouldn't attend care. So if they're having symptoms and they go in for testing, then they shouldn't be in care while that test is pending. That's a little bit different, and the reason is because we can go in and get tested, and it is a priority group. And so you might have just decided to have a test because you were concerned about exposure, or because it was being offered, and you wanted to go ahead and have a test done, but you're not having any symptoms. That's a different scenario. We're really just saying if it's a pending COVID test result because you're ill, you need to not be in care. Just want to say no floating staff. I can't say that enough because that is always the challenge. Try to avoid mixing of groups and really putting some of those strategies in place. And then if you're, the CDC has a great cleaning and disinfecting your facility, and it really talks through what to do if someone's been ill or test positive. And so that's a great guidance document. You can always reach out to your nurse consultant. She can directly right there. I actually linked it on the Healthy Childcare Iowa COVID section, and I'll show you actually our website in just a couple slides, so you can know where to look for that cleaning and disinfecting. CDC has a lot of different cleaning and disinfecting for different businesses, but there's one that's really helpful that's for childcare, or the one that's specifically around if somebody's ill. So something for you to be able to look at. We're just continuing to say, stay healthy, stay home if you're not healthy. Avoid going out in public when you're not healthy, because we want to continue to use those good practices that we've been doing for many months now of washing our hands, staying home when we're sick, using hand sanitizer if you don't have soap and water available. So just those really covering your cough, using a mask and wearing that when you're out, avoiding large crowds. I mean, I think those things are really just very good recommendations overall to stay healthy for yourself and for staff, and encourage your families to do that. The Iowa Department of Public Health has some great posters on the website, and so does the CDC. So, put posters up just to encourage and remind people. Let's see. Oops, skipped ahead here. Just a couple, I'm just looking at time here. I think we have enough time. I'm just gonna real quick go through some of the common COVID questions that seem to be coming across my desk a lot. There is a difference between cloth face coverings and face shields, and I just wanna let you know that, that the Centers for Disease Control has been clear about that. Face shields by themselves do not offer protection. And there's different, they say if you're only going to use a face shield, that it needs to be a specific type that wraps completely around and under the chin area, because if you would cough or sneeze, a face shield, just has that front protection, but not the sides. So using a face shield with a cloth face covering does give extra protection. So that's an option. But I have seen, I've had a lot of questions about, can we just do a face shield because we want kids to be able to see our face? And I totally agree on that part, that we want kids to be able to see our smiles and our face as we're talking with them. But just using a face shield alone might not really be giving you much protection at all. And so just to look at that, the CDC has some specific information around that, but I wanted to just let you know that, that there is a difference with the types of face shields that are available on the market. There is the hand sanitizers with methanols. That was an FDA warning that came out, and I actually, there's a link on our Healthy Childcare Iowa website about that. So if that's a concern for you, there is a list on the FDA website that you can actually look to see if the brand that you have has methanol. Methanol can actually be absorbed through the skin and has caused some toxicity and some injuries. So we want to make sure those are not being used in care. Let's see, bleach dilution recipes. The CDC is aware. We've actually, our coordinator group working alongside with the AAP did put in a request for the CDC to not have bleach dilution recipes on their website, because we know that that really those recipes are related to kind of regular household bleach, and it's not specific to the bleach you might actually have that you're using in care. So I'm not sure what they're going to do about that, but the request has been put forward. And we'll just say that, if you're not sure about what your dilution and your dwell time should be on your bleach that you're specifically using right now, because you can't find your disinfectant and you've had to go back to bleach, that you reach out to your nurse consultant and they can help you with that, looking at those, what your label is or the EPA document states in terms of what the dilution should be. Which, when I say dilution, water to bleach mixture, and then also the dwell time that's needed for COVID specific, so they can help you with that. 70% alcohol for disinfecting. We've actually had I've had a couple programs because they can buy alcohol, 70% alcohol for hand sanitizer, that they were wondering if they could use that for disinfecting, because that is on the CDC website, that if you can't find your disinfectant and you can't find bleach, that you could use 70% alcohol for disinfecting. And I'm just going to say this is a concern in childcare, and we would say not to do this in childcare. And because 70%, although it is an alternative for disinfecting, we do have some concerns about that for children. That is, there's the Iowa Poison Control has concerns about 70% alcohol being used for disinfecting. So we really want to avoid using that. And just so you're aware, in terms of alcohol-based solutions, they do have warnings of keeping out of reach of children. It can cause eye irritation if by accident was sprayed in the eye. And then there is a requirement to call poison control. So that is a concern, and we want to avoid that in the childcare industry. And then lastly, I just want to say that outdoor play environments, we do get a lot of questions about outdoor play environments, and you can definitely reach out to your local nurse consultant specifically about your outdoor area. But in general, the National Program for Playground Safety, I don't know if you're all aware, they're actually based out of University of Northern Iowa here in Iowa. So they're a great local resource for us, but they're nationally known. And they have some great COVID specific handouts on their website. So just if you want to, you can Google National Program for Playground Safety, or you can go to University of Northern Iowa website and find them that way. Or link from our website, Healthy Childcare Iowa, but they have some great COVID specific information on outdoor play environments.
Great. And there is one question in
Another
the chat
question?
box.
Okay. Great.
Yep. Can you just talk a little bit? So I know we know that without masks, that physical distancing is really, really important. But what about with masks? How important is it to stay physically distant from others if you do have a mask on? You know, is that like if you're wearing masks, does it not matter as much than to stay physically distant from people?
Well, I think both are effective ways to mitigate exposure. But in general, they say that, you know, if you cannot maintain physical distance of 6 feet or more, that you should have a cloth face covering because we know that adds, you know, has some protection. But, and I would just say in the childcare world, it's very challenging to maintain physical distancing at all times. So wearing a cloth face covering gives that added protection to help mitigate the risk for exposure.
Absolutely. And there is one more. So
Okay.
this provider shares their facility with the church, and there was a recommendation for cleaning large open spaces that they utilize for gross motor sports and activities. And the floor is waxed, so the church doesn't want the floor to get ruined. So she's wondering if she can mop with the disinfectant and a mop, or if she should spray her disinfectant to clean that area.
I'm going to refer you to your local nurse consultant on that one, because I think knowing your program, that might be helpful to actually walk through what would work best. I can see from both sides that they want to be safeguarding their area, but there are you know, there are different disinfectants out there that might be better, you know, than others in terms of the wax floor and all that. So if you're not sure, and if your local nurse consultant isn't quite sure either, we can always do some research on that and help you out.
Great, thank you. That's it for now.
Okay. I just want to show you, so our Healthy Childcare Iowa website, and you have the link up there. We have our COVID section on the printed products section. So we have tabs kind of on the side. If you would click on the Childcare Nurse Consultant tab, that would bring up the map, and it would bring up the contact, find your nurse consultant, and then you'd be able to get the contact information for your local nurse consultant. There's some other tabs here, and I was just going to run through them real quick. There's a child safety tab, some information about physical activity and screen time, and then the tab, the FDA warnings actually on that tab, and you can sign up through that tab for alerts from the Consumer Product Safety Commission, for drug recalls, for food recalls. So that's actually something that might be helpful just in general to get on their listserv, so you can get those alerts directly to your email box. The Find Childcare helps to link you to CCR&R and to Iowa Department of Human Services. And then the printed products tab is probably the one that most people know from our website because we have a lot of products on there and handouts and fact sheets that you can download and use in your business. But we do have a COVID section. We put it actually in this area so that because this was the most common link that I think most everyone knows from our website is the printed products section. And we have kind of a little COVID section. And this is kind of, this box just shows kind of what it looks like. And that's where we have our guidance documents and some of our links directly to some of these things that I've mentioned today, so that you don't, sometimes it's challenging on the CDC and the IDPH website to find what you're looking for. You know, you can always reach out to either me or to your local nurse consultant if you can't find something, because we we know where to get it most of the time. But if not, and CCR&R too, also, reach out to your CCR&R consultant because they know where, guidance documents are challenging sometimes to find. But I tried to put direct links on here and update this. I was every Monday go through and make sure everything's current. As of this morning, something had changed over the weekend. That seems to always happen. So I try to keep this up to date as much as possible so that you can find the information that you're looking for. And there is our map of our nurse consultants. So you can kind of see where our consultants are. And like I said, there's a direct link. If you go to the Healthy Childcare Iowa and /consultants, you'll actually go directly to our tab where it says find your nurse consultant, or you can just go on our main website. And that's it, unless we have any additional questions or if any of the nurse consultants want to chime in.
There aren't any more questions right now. And I was just going to say too, if any of you providers need help finding your childcare nurse consultant, I can definitely help by connecting you with them as well. So you can always contact me too if you need that. Here, I'm going to share. Is that your last slide, Heidi?
Yeah.
Okay, I was just going to share my screen for the my contact information. I know a lot of you already have it, and especially because I sent out the link, but I just figured that I would share this last slide with you, kind of a thank you slide with my contact information on it. If you have any questions at all, I would be happy to help you get that answered. So there's my name up there, the community development specialist, and my email and my phone number are up there. And then also I will send out the link to access the recording via email after we're all finished up here. So yeah, I don't see any more questions in the chat box, but you can reach out to Heidi for questions. You can reach out to your childcare nurse consultant for specific questions, or you can absolutely reach out to me and I will find a way to get your question answered. And other than that, thank you so much for being on with us today. And such a huge thank you to Heidi. You're always so available for providers. And it's so nice, like you said, things change every day. And something you said today could definitely be different tomorrow. So it's so nice that you are available for providers to ask those questions.
Well, thanks so much for asking me to join in today. And then also I will look up at that information kind of on that air purifiers and the UV sanitizers. I will share that information. I'll send it to you and then you can share it out.
Awesome. That sounds great. Okay, well, no further questions. So thank you, childcare providers, for being on, and thanks for IDPH for being on. And I will follow up with you, Heidi, to get that information and any other questions that might need answered.
Thank you so much. And thank you all to the childcare providers that are on the call. I know that this has been very stressful for programs. There's a lot of information and we're just here to help you. And we really appreciate all that you're doing to keep childcare open in the state of Iowa and to keep children healthy and safe. Thank you.
Absolutely. Okay, thank you so much, everyone. Have a great rest of your day.